Do your eyes sting and burn or feel scratchy, or do you have difficulty wearing your contact lenses? You may suffer from what's known as dry eye syndrome. It's a problem that's seen by area doctors. Joining us today in the KCRA newsroom is Dr. Brent Reed from Griffin and Reed Eyecare to talk about the problem of dry eyes. Thank you so much for joining us, Dr. Reed.
Thank you, Mary.
So how common is this problem for dry eye?
Unfortunately, a lot more common than I wish it was. Greater than 75% of the people over 65 suffer from some form of dry eye. And in fact, I recently read an article in a peer-reviewed journal that talked about the coming epidemic of dry eye among baby boomers.
Dr. Reed, what are the symptoms of dry eye, if you don't mind?
Well, other than the scratchy irritation, there's sometimes associated with a stringy mucus-like discharge, an oily layer to the tear film, which is excessive, that causes intermittent blurring when you're blinking. And in addition to that, you're excessively sensitive to both contact lens wear and also environmental factors like circulating air from ceiling fans or circulating air from vents overhead.
What are some of the treatments that you recommend? Do you want to use eye drops or something like that?
That's probably the #1 treatment, Mary. The best thing to try first is to use an over-the-counter artificial tear. If you find yourself using the teardrops more frequently than 4 or 5 times a day, a non-preserved brand that comes in a disposable vial is probably the best. If you're using it only up to 4 or 5 times a day, then a brand that can be reused with a resealable vial is probably okay.
Dr. Reed, can it be harmful if you don't treat it?
It can, in the sense that it can cause some decrease in vision. It can make you more susceptible to infection and other problems. And in addition, I didn't mention, Mary, that there's another treatment for those who don't wish to put in tears as frequently that's very good. And that is, in the last few years, the development of both temporary and permanent punctal plugs that are placed in the tear drains that allow outflow of tears are then blocked off, and then an increase in the tear film is seen, and patients are much more comfortable with those.
So pretty much this is somewhat of a permanent problem if you do in fact have it.
Unfortunately, it can be, and oftentimes it's exacerbated by the use of certain medications which are very common, including things like diuretics, beta blockers, antihistamines, antidepressants, sleeping medications, and pain relievers. All can have an effect on dry eye and make it much worse for people who are susceptible.
All right, Dr. Reed, thank you very much for talking to us about dry eye, and we really appreciate it.
Thank you.